It is the fifth biannual stakeholders engagement meeting in Abuja with the theme Strategic Pivoting Towards Program Simplification and Sustainable Public Health Intervention, where participants call on the two tiers of government to utilize the power of data and innovation to bridge equity gaps and drive significant progress in the management of AIDS in Nigeria. At the event put together by the U.S. Center for Disease Control Nigeria, experts say the stage has been set for the simplification of the U.S. President's programs on the vision of global HIV and TB and emergency plan for AIDS relief as an important steps towards sustainability. The Director General of the National Agency for the Control of AIDS, Dr. Temitope Ilori, said, sustaining Nigeria's HIV response requires simplifying service delivery and integrating interventions into existing systems, adding that government is working to sustain the HIV national response beyond 2030.
We believe that it's time for us to take ownership, and this is going to be done in phases. We have the programmatic phase, we have the financial phase, where we're going to put structures down to actually ensure that HIV response is no longer verticalized, but rather integrated into the national, mandated government structures.
For the Lagos State Commissioner for Health, Professor Akin Abayomi, the importance of rigorous ethical trials for new medical interventions, particularly in the fight against HIV, is very sacrosanct.
We have strong programmatic activity around digitalization. It's important, at least for us in Lagos and many other states, are very hard at pushing forward with digital programs. I think once we make progress with that, it will become easier for us to really, in a more accurate way, understand the disease burden around other diseases, but particularly the ones that really cause us concern, like HIV and mother-to-child transmission, which is a high priority in other states that were able to stop that process.
Working together with communities as well as with government, we have an opportunity to advance our HIV response efforts through increased domestic resource mobilization to ensure that we do have the resources for ARV commodities as well as lab reagents and other necessities and products.
The Chief Executive of Excellence Community Education Welfare Scheme, Dr. Andy Eyo, and Dr. Paul Okubo, Permanent Secretary, Delta State Hospitals Management Board, give an insight into the program and hopes on ending AIDS pandemic by 2030.
What we're seeing here is that truly 2030 is possible. That means we can end AIDS in Nigeria by 2030, and that the state governments are beginning to show a strong desire to take leadership and to invest resources.
By 2030, yes, it will no longer be like an epidemic. By 2030, yes, all the efforts are geared towards making sure that by 2030, HIV will not be, an epidemic emergency in our country.
As stakeholders review strategies and current progress towards health workforce optimization and integration, they pray that decisions taken on critical program pivots for country ownership and sustainability of public health interventions in Nigeria will be taken seriously by the authorities.